Welcome to The Hill's Coronavirus Report. I'm Steve Clemons, editor-at-large of The Hill. Each day we are interviewing consequential leaders and innovators in the battle against the coronavirus. And today is an Innovator Day. Just this week, some success in the war against COVID-19. A steroid has been found to reduce death rates with severe cases of the virus. Before therapeutics are necessary, most public health professionals laud testing as a means to combat COVID-19. Right here in D.C., fire stations are doing walk-up testing for individuals who want it. But in other areas of the country, drive-through testing has become a staple in trying to get a handle on what the numbers truly are, especially as it appears almost half of the U.S. is seeing a spike in cases. Even with all those efforts, rapid results testing continues to pursue success. One company developing a quick test also says its primary aim is to leverage biology for constructive purposes. Take a look at this. It's a prototype for a rapid results test developed by Botanisol Analytics. The hope is that fast results might slow the spread of the coronavirus. Joining me now to talk about where they are in the process is Botanisol Holdings CEO Dave Talenfeld. Dave, thanks so much for joining us today. As I understand it, the innovation that you have created is basically a way to look at people's cellular structure, to look at the cells with a system that can instantly tell whether they have been infected by coronavirus or not. Tell us about what you've invented.
Sure. Well, I can't take credit for the invention. That honor belongs to Tom Milster at the College of Optical Sciences at the University of Arizona. But the exciting thing about our screening tool is that it's a small, portable, automated, single-button interface, easy to use by minimally trained professionals, and it requires no chemistry. It uses a laser to excite the molecules in the sample and then measure the unique signature of the virus in real time. It can go anywhere there's 120 volt power, and it is very adaptable. It operates extremely quickly. We're talking about positive results in as little as 2 minutes, negative results in under 10, and it can be updated in real time to look for emerging threats. So it can detect not only COVID-19, but it can detect other threats and pathogens in the future by software update.
Now, I'm just fascinated because we've all been talking about swabs, and I know people who were just tested yesterday and who aren't going to have their test results for 4 days. So this has been a nightmare for many people who are trying to go back to work or trying to establish health environments. People who are in nursing homes or elder care facilities. So I guess, I just want to get right down to it. Have you tried this system out thus far with those that have been exposed to coronavirus or infected by it and those who have not? How have those tests gone?
Sure. So these types of systems have been validated in a laboratory environment. The technique involved is called surface-enhanced Raman spectroscopy. And there have been over 19,000 papers published on this by leading academic institutions over the last 10 years. Our company will be the first to field this kind of system commercially, and we are under contract with the Air Force Research Laboratory Biosurveillance Unit to supply these pieces of equipment to the National Guard late this year. And we will have participation from the military in supporting fast-track clinical studies with the technology.
Now, I know you've won an award, as I understand it, either from the Air Force or Department of Defense for this work. Tell us about that.
Sure, we've won a few awards at this point. We have a National Science Foundation I-Corps Award. We have a DC Tech Connect Innovator Award. We have a 40 Under 40 Award from the Armed Forces Communications and Electronics Association. Very proud of that one. We also were selected as part of the Innovators Showcase of the Intelligence and National Security Association in partnership with the Office of the Director of National Intelligence. And our scientists are highly, highly award-winning as well. One example being Dr. Jacob Shelley of the Shelley Lab at RPI. He has been named one of the top 40 under 40 scientists in the world by analytical scientists, and also an emerging leader in atomic spectroscopy by Spectrometry magazine. So nothing but good things to say about our team. They are the best in the world, and we are working very hard to ensure that we have an opportunity to contain and mitigate the spread of this virus, and also to help enable restoration of economic activity starting late this year and early next.
I want my audience, who is mostly, I think, a lay audience. We may have a lot of people out there who are, science wonks and who get a lot of this. But if you could take them down and explain a little bit more about how it works, and in my own research about what you have brought to the table, is that this can also be used. This process has been used in identifying pathogens in agriculture and crops. And it's basically, as you said, focusing a laser on cells and seeing where those cells have done. But can you explain it to me? Because I'm fascinated that this has popped up. It sounds promising to me anyway, for everything from airplanes and whatnot. But just give us a kind of layperson's understanding of how the system actually works.
Sure. What I'll do is I'll contrast this system with the current gold standard testing modalities. The crop stuff we did, I'm a 3-time life science entrepreneur. We did some development of new drugs from botanical sources, and then we learned how to manufacture, in fact, bioproduce drugs and other valuable ingredients from agriculture. This latest technology that we're working with does have all sorts of interesting life science applications, including in precision agriculture. But the one we're most excited about is disease screening. That will probably ultimately be the most important thing I do with my life in terms of both this crisis and future threats to human health and welfare, like cancer markers, for example. But in terms of how it works, the current gold standard equipment involves polymerase chain reaction, or PCR testing, and also antibody tests. And those sorts of tests work very well. They're highly accurate, but they generally require a refrigerator-sized machine that can't leave a laboratory, that has to be operated by a PhD, and involves a lot of expensive and difficult consumables. So one of the main problems with the current equipment has been that in order to respond to a new threat, such as COVID-19, the design, development, manufacture, and shipment of new consumables and reagents has been necessary. And that's a several weeks to several months process, which has prevented us from having adequate testing to better prevent the human tragedy that we've seen play out. Now, contrast that with our equipment. Our equipment requires no consumables, can be operated by minimally trained personnel, needs only electricity, is providing results in minutes, and can be updated almost overnight to detect new threats. So we can begin to imagine a scenario where, let's say, a piece of our equipment is placed in the US Embassy in Beijing, a threat emerges in Wuhan, and within days, samples are taken to be analyzed and characterized by our equipment. At that point, those digital signals can be distributed worldwide to all of our machines anywhere, in places like airports, government buildings, schools, hospitals, first responders, you name it. And with a software update, they can now detect the new threat and prevent its spread. The use of machine learning algorithms also enables us to make important inferences about new threats. So, for example, should the virus mutate in some difficult way, our software is able to analyze that difference and suggest, you know what, this is close to the threat that we've been seeing in the field, but it's slightly different, and we may want to take a closer look here. So there are a number of advantages to using this laser-based technique. Speed, flexibility, ease of use, goes anywhere. It's only about the size of a file box or a microwave, and it will get smaller and faster as we go. So our long-term vision is to save and protect lives, as we like to say, anywhere the light shines. We use our technology to illuminate the unknown, and someday we anticipate that these kinds of sensors will be ubiquitous, solving not only crises like this one, but also changing the way we perform medical triage in the future, and putting the full power of a chemical and biological laboratory ultimately in the palm of the consumer's hand. Now, we're a long way from that, and I'm I'm limited in terms of the claims that I can assert at this point for regulatory reasons. But I would say I will spend at least the next 10 years of my life uh, excited about and developing these solutions for the citizens of the United States and our allies.
Well, is the world beating its way to your door to get these little gadgets? And are you able to make enough of them?
Yeah, so we've become very popular in the past 3 months. Um, Fortunately, our existing military contracts enable us to rapidly scale up. We've received 2 tranches of funding from the Air Force. This is a credit. I want to give a special thanks to Captain Steve Lawver of AFWorks and Air Force Ventures. Thanks to his support, we are now able to add additional national security users to our existing contract. And also thanks to our scale-up partner, we have an ability to produce up to 100,000 of these systems in 2021.
How many does the United States need if it were to kind of look at, I don't know, community use, manufacturing plants, transportation networks like airplanes and whatnot? I mean, places where, I don't know, political rallies, you want to screen people in there,
Sure.
or events by the Hill. I'm just sort of, when I think about all the potential applications of people going into, the White House Correspondents' Dinner, we go through security screeners. Are we going to be going through the kinds of screeners that you have now as part of our normal life?
Yes, I think so. We will not have the capacity immediately to serve all of these possible needs, but we are scaling up as rapidly as is humanly possible. If you just look at, let's say we were to place machines in every international airport, we're probably looking at least 10,000 machines there, maybe more. So what we're doing is we're focusing on the most critical users initially. So we think that the highest and best initial use for the technology is national security, medicine later. But right now, what our military users are asking us to do is place this equipment around key personnel and critical infrastructure. So the first systems will go around very important persons and also very important installations. So that would include things like politicians, military chain of command, critical infrastructure like power plants, for example. So I'll give you an example. Something like a nuclear power plant. If it were to go down due to the entirety of the staff becoming severely ill at the same time, it would cripple the ability of first responders in the vicinity of the power plant to use all the electronic equipment that they have. And so for that reason, by fielding a number of systems around such critical infrastructure, we can prevent those kinds of instances. And we're very proud to work with national security stakeholders to make sure that happens. After that, there are lots of examples. So take aircraft carriers. We had the Theodore Roosevelt sidelined indefinitely due to an outbreak of the ship. And this prevents us from being able to project power and protect our allies worldwide. This is an example of an early use that we are committed to serving. And later, as we scale up, we can put these devices, pretty much anywhere. So initially, highest and best use, protecting the nation. Later on, protecting the consumer broadly.
Great. Last question, real quick. I know whenever you sell something to the government, it is expensive, but when I buy mine, what's it going to cost the normal consumer out there?
Well, unfortunately, for reasons having to do with military contracting, I am not able to comment on that. What I can say in general is that we are doing our very best to scale manufacturing and to offer attractive lease options and other means for acquiring the technology, such as we are able to accelerate its deployment. So, our interest is primarily not a profits interest at this stage. Our interest is to make sure that we can save and protect the people who count on us.
Well, Dave, I want to thank you. I mean, it's fascinating to hear this and to sort of see innovation happening in this space. I was enthused when I heard from your team, and very grateful for you coming on and sharing hopefully what will be a new pathway on testing in the country. So thanks to David Talenfeld from Botanisol Analytics. And I want to thank all of you for joining me today. I'm Steve Clemons. We'll see you tomorrow. Be well.